Good morning, students. Today we are going to discuss the ulna bone. This is the medial bone of the forearm. So in this video I will discuss the parts of the bone only, and in my next video we will discuss the attachment. Now for side determination, what are the important points which determine the side of this bone? There is one hook-like process which is concave anteriorly. So this process with concave surface should face anteriorly. This hole is known as trochlear notch and it should face anteriorly again. Now it has a sharp border of the shaft which is the lateral border, and we call it as intraosseous border. So this border should face laterally. Trochlear notch should face anteriorly. The concave anterior surface of the hook should face anteriorly. So these features, they determine the side of the bone. So keeping in mind all these features, so this bone is of right side. Now coming to the different parts of this bone, it has upper end, it has shaft, it has lower end. So upper end has two processes and two notches. So processes are oligrenan process, coronoid process. So this is the coronoid process and this is the oligrenan process, and two notches. So this is trochlear notch and here is the radial notch, this black one. This is the radial notch. Now if we see the shaft portion, now this shaft portion has three borders and three surfaces. So as there is a lateral border, as I have told you that it is the intraosseous border, it has anterior border, it has anterior border, and opposite to it this is the posterior border. So this is the posterior border. Now correspondingly there are three surfaces: anterior surface, posterior surface, and medial surface. So three surfaces and three borders of the shaft, and the lower end has a rounded part. This is known as the head of the ulna, and this projection is known as the styloid process of the ulna. So these are the different parts of the bone. Now coming to the detailed description of these parts, first we will discuss the upper end. As I have told you that it has two processes. Out of this there is one process which is oligrenan process. Now first we will discuss the oligrenan process. Now this oligrenan process has, you can see, it has superior surface, it has anterior surface, this is the anterior surface, this is the superior surface, it has posterior surface. Now this posterior surface is triangular in shape. You can see the apex of which is continuing with the posterior border. So you can see. So it is a triangular structure, that is posterior surface is triangular and subcutaneous, and the apex of which is continuing with the posterior border of the shaft. Now coming to the medial surface. This is the medial surface of oligrenan process. It is continuing with the medial surface of the shaft of ulna. Clear? Then is the lateral surface. So this is the lateral surface, you can see, and this lateral surface is continuing with the posterior surface of the ulna. So these are the five surfaces. So five surfaces are superior, anterior, medial, lateral, and posterior surface. Now coming to the coronoid process. Now this coronoid process is contributing to the trochlear notch but inferiorly. Superiorly was contributed by oligrenan process. So the superior surface of coronoid process is there, which is going to contribute to the trochlear notch. Then it has anterior surface. You can see there is a rough area over here. This is the anterior surface, and the lower end of this rough area is known as ulnar tuberosity. So this is ulnar tuberosity. Then it has lateral surface. This is the lateral surface of the coronoid process, you can see. Now this lateral surface has a notch which is known as the radial notch. This radial notch has attachment of annular ligament. So it has radial notch above which has attachment of annular ligament anteriorly and posteriorly. And below this radial notch there is a rough area or rough depressed area which is giving you can say space to the radial tuberosity. So when the radial head is going to articulate with this radial notch, the radial tuberosity rests against this depressed area. And this depressed area is bounded posteriorly by a crest-like structure. So this is known as the supinator crest. And this is the medial surface of coronoid process. So there are four surfaces for coronoid process: superior surface, anterior surface which is rough and lower part of which is forming the ulnar tuberosity, lateral surface which has radial notch and rough depressed area, and the medial surface. Now coming to the two notches which are present in the upper end, one is trochlear notch. Now this trochlear notch is formed by both olecranon as well as coronoid process. So which surface of the olecranon is contributing to it? That is the anterior surface of the olecranon is contributing to the upper part of trochlear notch, and the superior surface of the coronoid process is contributing to the lower part of the trochlear notch. Now this trochlear notch is covered by the capsular ligament of which joint? At the elbow joint, because this trochlear notch is going to articulate with the trochlea of the humerus. So it is bounded by the capsular ligament, but one important thing is this capsular ligament is not present at this end where the radial notch is present. Now coming to the next portion, that is radial notch. First notch was trochlear notch, second notch is radial notch. As I have told you, this radial notch is going to articulate with the head of the radius, and anterior and posterior margin of this radial notch, they are covered by annular ligament. So when the head of radius is going to articulate here, and it is bounded by the annular ligament, then they form the superior radio-ulnar joint. Now coming to the shaft portion. In shaft portion, what are the different borders and surfaces? First border, as I have told you, this is the lateral border, which is sharp in the center, you can see. If we trace the border upward, it is continuing with the supinator crest. So lateral border is continuing with the supinator crest above, and below if we trace it, it is traced at the lateral side of the head of ulna. It is traced at the lateral side of the head of ulna. So this is the lateral border, which is known as the interosseous border. Now coming to the anterior border. So this is the anterior border. You can see this anterior border is starting from the medial margin of the ulnar tuberosity. You can see here. So it is medial margin of the ulnar tuberosity running downward in the lower portion. This part is going little bit backward. It is going little bit backward to end in the styloid process. You can see here. So this border is starting from the medial margin of the ulnar tuberosity coming downward and little bit going backward to end in front of the styloid process. Now here is the posterior border now. Now as I have told you, this is the subcutaneous posterior surface of the olecranon, which is triangular in shape, the apex of which is continuing with the posterior border. As we trace the posterior border downward, it is ending at the base of styloid process. So this is the posterior border. Now coming to the surfaces of the shaft. Between the interosseous border and anterior border, this is the anterior surface of the shaft. Clear? Between the interosseous border and the posterior border, this is the posterior surface. You can see this is the posterior surface, and between the posterior border and the anterior border, this is the medial surface. Clear? So I repeat, this is the anterior surface between anterior and interosseous border. Between the anterior and posterior border, this is the medial surface. As I will rotate it, this is the posterior border, this is the interosseous border. So this is the posterior surface. Now if we come to the posterior surface, you can see an oblique line which is running downward. You can see here, it is running downward and medially. So it divides the posterior surface into upper triangular area and lower area. So next you can see this is the posterior border, this is the interosseous border. You can see in between there is a vertical ridge is felt over here. So this lower portion is further divided by a vertical ridge into medial portion and lateral portion. So this lateral portion is lying between the interosseous border and the vertical ridge. So this is important for the posterior surface. Posterior surface is divided into three parts by two lines. One line is oblique line, which is running downward and medially, which divide the posterior surface into upper triangular area and lower portion. and the lower portion is further divided by a vertical ridge, you can see here. So vertical ridge into medial portion and lateral portion. So that is important. Coming to the lower portion, this is the head of the ulna, this is the styloid process of the ulna. So I will tell you, because we have discussed the different parts and their articulation with the different bone, because this bone is going to articulate, this part is going to articulate with the trochlea of the humerus, it is going to articulate with the head of the radius, and this ulnar head is going to articulate with the ulnar notch which is present on the radius. So important ligament I have told you, here is the capsular ligament at the elbow joint, but that is deficient at the superior margin of the radial notch. Anterior and posterior margin of radial notch, they are giving attachment to the annular ligament, that is important. Then this lateral border is going to give attachment to the interosseous border, and this styloid process is going to give attachment to the ulnar collateral ligament, and this lateral part of this styloid process is going to give the articular disc of inferior radio-ulnar joint, because this head of the ulna is going to articulate with the ulnar notch present on the radius to form the inferior radio-ulnar joint. So this articular disc is attached to the lateral margin of the styloid process. So this is all about the different parts of the bone. So in my next video we will discuss the attachment. Thank you.